Tips and tricks for when working with a nursing student. You've been allocated a student for the day and you're not quite sure how you're going to deal with it, how you're going to teach them, what they know, if you want to teach, or how you're going to do it. I'm going to give you some pointers on how to make your day as enjoyable as possible for both the student and yourself. So when you find out that you're going to have a student for the day, it may be in the handover room or wherever you do report, and the student, everyone's sitting around. Whatever you do, don't roll your eyes and let out a big sigh. Fine, if I have to, I will. It will affect the student immensely. Instead, try this. Who? A student? Which one? Tiffany? Oh, hi, my name's Penny. We're working together today. It is much better if you let off a big smile and say, hello, you are working with me today. The next thing you should do is ask your student where they're up to in their nursing degree. Are they first year, second, third year? What do they know? What don't they know? What clinical placements have they had before? And are they having to finish off some assessments on this clinical placement? Don't do what Negative Nancy would do. What's that? You're a third year, are you? That doesn't matter really. For goodness sake, just don't touch anything. Just stay here and look and watch me. Don't do anything, okay? Thank you. Instead, try Positive Penny's approach. What year are you, Tiffany? Third year. Oh, great. That's great. You need to do some dressings? We got plenty of them today, actually. In fact, we need to put a nasogastric tube in today on a patient. I haven't done it in a while. You just did it in labs? Well, how about I just watch you do it then? You can teach me a thing or two, eh? I follow you around today, okay? Then what I recommend you do is set expectations early in the shift. Talk to your student and say what we need to achieve today. These are our patients. This is how we're going to do it. And this is what I expect of you by the end of the shift. So this might include a time grid or a shift planner where the student can write down what needs to be done for the shift so that you understand that they understand what needs to be done, and then they tick off when they've achieved it. So at my workplace we have these time grids in our handover room: AM shift, PM shift, night duty, and you can just take one for yourself and plan out your day. It is a great tool for experienced nurses, but most of all for new nurses. So have a look at how Nancy plans out her day. Tiffany, put everything in grids like this, makes it very clear and easy to follow. And don't forget to put your tea break in there, because otherwise she'll never have it. Now have a look at how Positive Penny does it and how nicely and clear it is to have that time grid to tick off. Alright Tiffany, this is how I plan my day. I write down all the things that need to be done, and then I tick them off when they're done. I give myself a pat on the back every time I tick it off, eh? And also, to be honest, it makes me not forget anything. It's a little reminder. If you want to give the shift planner or the time grid a go, I've made a generic one and you can grab that in the show notes. Make sure your student is involved and is hands-on in the tasks of the day. Remember, you were a student yourself once, so how did you learn? It was probably by doing all the tasks. So get your student to do as much as they're allowed to and that they're trained to do in their course under your supervision and guidance. Don't be a Negative Nancy in this instance. You were all a student once. Alright, so we're gonna empty this catheter here, Tiffany. Have you done it before? Alright, well, you go ahead then. Alright, you don't, no. Actually, Tiffany, move. I'll do it myself. You watch me, okay? Stay here. Just stay, watch. Just watch, okay? Oh, goodness. Try Positive Penny's approach. Alright, Tiffany, bed 2 actually needs some blood drawn, and I was thinking maybe you could do it. No? No, I think you can. You've done it, and I've seen you do it before. Yeah, you'll be fine. I'll watch you. I'll do it with you, okay? It'll be easy. She's got great veins. Great veins. You'll be fine. I'll do it with you. Alright, Tiffany. Remember the dressing we did earlier in the day? Yep. Well, we're gonna do the same thing right here with Mr. Smith, and you're gonna do it, okay? No, Mr. Smith doesn't mind. I've already asked him. He's completely fine with it. Alright? Let's do it. So how do you deal with a student that doesn't seem very interested to learn? For me, it works when I sort of put a little bit of pressure and responsibility on to them. So for example, I'll take a step back and I'll ask them, what do you think we should do now? should we empty that catheter or do a shower, or what do you think we should start with? And they might say, look, I think we should do the medication round first. And that makes me think, okay, they know how to time prioritize. And then I say, that's great, let's do it. And I'll follow them instead of them following me around all day. Remember, we were all students once. Be the nurse who other students look up to. Teach them well, and they'll remember you forever. Thanks for watching, guys. I'll see you on the next video, and as always, remember, listen with your heart.